basically pushed us out of our comfort zone and brought us the confidence that we need to apply the skills. We had a really fun experience here working on each other, and I think it's very memorable because when you work on each other, you remember mostly every experience that you can. And I feel like going forward, I hope everybody will meet each other in the hospitals and the nursing homes, and we can connect and talk about how we grow together.
Yeah.
Guys, congrats to Emily. Emily was one of the she was one of the A students, right?
Esther.
I mean, Esther was one of the A students. Sorry about that, Miss Benjamin. She was one of the A students. She did excellent, and her courage and her dedication as a CNA was really, really great. Thank you, Esther.
Thank you for giving us
Very
the
good.
opportunity to be here and see.
Okay, I'm gonna put the bell around you to help me to get up. Ace the first.
Okay, guys, so today the CNA Carla is ambulating a patient 10 steps forward and 10 steps backwards and place the patient in a wheelchair. This is one of Prometric testable skills. So we do these couple second videos to kind of help the students to learn the skills and to deepen their understanding of the skills. We're not doing it for fame or anything. We're just doing it for educational purposes. So that way the students them can look back and learn the skills. If you enjoy content like these, please consider subscribing to my page, and please drop a heart
Is that
for
okay for you? Here?
the student.
What type? What about it? Here. Okay.
So a gait belt is a belt that is placed over the patient clothing.
I'm gonna put my gloves to put your shoes.
So you're putting her shoes on now?
Yeah.
Okay, good. I'm just gonna end the video though, okay? Guys, we have a beautiful young lady here by the name of Valencia, right, Valencia? Hi. Valencia is doing foot care today. So this is one of Prometric scale. So what are you doing, Valencia? Tell us.
I'm gonna wet the cloth and wet her foot.
Okay, you're washing the patient, but this
check
is one of
for,
Prometric scale, right?
Yeah, I'm gonna check for ringworms and stuff.
She's doing an assessment of the skin integrity. She's checking for ringworms, athlete's foot, callus, and what else? Any lesions, right?
Yeah,
No redness, no ulcers noted.
yeah.
Okay. So you're doing the soapy water, then you're gonna rinse it.
Yeah. Jones, you have a nice foot.
Jones blushing.
Yeah, she's nice and stylish.
Guys, this is one of Prometric skills, so
I'm gonna change the bucket and new bucket.
I think you don't have to change the bucket. I think you're alright.
No, but it's dirty.
I think you don't put the.
You're not supposed to put the soapy towel inside.
in the water.
Yeah.
Yeah. You got to.
Water's still clean.
Also, it's clean. You're good.
Yeah, water's clean.
All right, guys. So this is one of Prometric skill. Drop a heart for Miss Valencia and a comment for her.
I'm gonna read.
Okay. I'm gonna put the bell around you to help me to get up. Ace the first.
Okay, guys. So today the CNA Carla is ambulating a patient 10 steps forward and 10 steps backwards and place the patient in a wheelchair. This is one of Prometric testable skills. So we do these couple second videos to kind of help the students to learn the skills and to deepen their understanding of the skills. We're not doing it for fame or anything. We're just doing it for educational purposes. So that way the students them can look back and learn the skills. If you enjoy content like these, please consider subscribing to my page, and please drop a heart
Is that
for
okay for you? Here?
the student.
What type? What about it? Here. Okay.
So a gait belt is a belt that is placed over the patient
I'm gonna
clothing.
put my gloves to put your shoes.
So you're putting her shoes on now?
Yeah.
Okay, good. I'm just gonna end the video though, okay? So think about where the heart, the normal heart rate is 60 to 100 beats per minute. But think about which part of the heart is this heart rhythms is initiated from. Think about it. It's not a hard question. It's basically the pacemaker of the heart. So that moment is up, and the correct answer is the SA node. And I'm going to bold this question for you so you have the correct answer. Let's move to question 4. So question 4 states the P wave on the EKG corresponds to which of the following electrical events? We know on the EKG we have different codes, the P, T, QRX complex, the PR interval. So think about the P wave. Ventricular depolarization, atrial depolarization, atrial repolarization, failure to capture. Take a moment and think about it. So that moment is up, and the correct answer is atrial depolarization. That's the correct answer, atrial depolarization. Let's look at, I think I have one more question. Okay, question number 5. I am going to read this question, and it's not a hard question, but it's a question where you have to select one or select all of the above. Sinus tachycardia may be seen as a response to, so think about it, sinus tachycardia. Tachycardia means the heart rate is above 60 to 100 is the normal. And if you're tachy, you're probably 140, 160, 180. And think about what are some of the contributing factors that can cause your heart rate to be increased. A, anxiety. B, pain. C, dehydration. D, all of the above. So take a moment and think what can cause your heart rate to be elevated. Guys, these questions, you can find them more so on your, if you're taking an EKG course or you're taking phlebotomist, these questions, RN exams, LPN exams, advanced the ACLS course, you can expect to see these questions. So that moment is up, and the correct answer to this question is D as in David, and I am going to be bolding it. Guys, so that is it for this video. Again, thank you so much for tuning in to my channel. I couldn't do it without you, and I wish all the nurses out there, the LPNs, the RN, the CNAs that are taking the state board exam, I wish you guys lots of luck. You guys are in my prayers every day. And, take your time, study hard, think about your question, think, it's that critical thinking skill, don't choose the one answer, think about